It was just a relief to finally find a doctor who knew what I had and how it could be treated or made stable. I see myself and with this disease like a volcano. It's active, but it's in stasis or something like that. And that's the way they treat this disease, in my case anyway. It cannot be exterminated or removed. It's like a chronic part of my life. But we were on the same level. I think the way I managed to find this doctor in the end was lots of questions. I actually think that some of the doctors on my way believed I was quite annoying and a problem because I continued to ask questions and was not satisfied with the way they managed this stuff. And later on I experienced that if they had done something in another way, my situation would have been better. Actually, a fun part in some way is that when I looked on my patient journal on the internet, and I learned that I had this mass in solar plexus, and it was blocking for my kidney for the urine to flow. And that was kind of the problem that gave me the pain. And then I called the emergency doctor or some sort of, and asked, should we put something down there to remove the blockage or something to save my kidney? And he thought that's a good question. But keep that in mind when you have an appointment. And I asked the same question there, and no, that's not important because you may have cancer. But 3 months later, I found this doctor who knew more about IgG4, and they had discussed my situation at a conference, and then they told me, we have agreed that maybe we should give your right kidney a chance and put in a catheter. And I was a bit surprised because that was sort of the same question that I asked myself 3 months earlier. But yeah, it was unfortunately too late. So yeah.